The information in this podcast is for educational purposes only and is not medical advice. Always consult your physician for medical concerns. Listening does not create a doctor-patient relationship.
Welcome to the Nervous Breakdown Podcast, where if it's the spine, the brain, or pain, we can explain in language that is plain. I'm Dr. Christopher Gay, a board-certified anesthesiologist and interventional pain specialist.
And I'm Dr. Estrada Bernard. I'm a board-certified neurosurgeon.
And today, we're keeping it personal. We already talked about my showdown with sciatica, but today we have a miracle worker in our midst. He is a surgeon that heals without a scalpel. Surgeon, heal thyself. Tell us how that happened.
Well, this is a description of how I got my cervical spine neck pain with nerve issues resolved without surgery. And I'm an advocate, and I tell my patients that surgery is not the first step. Surgery is the last resort if other things, conservative, non-surgical treatment, don't work. So I'm going to describe how I practice what I preach.
Yeah. So take us back. When did you first feel something, or kind of how did you notice that you had, what symptoms did you have?
Well, the symptoms I had initially were neck pain and pain in my shoulder blade area.
Okay.
It was just right on the right side, and it was just an achiness. You know, I operate long hours, and so I thought it might have just been due to a period of time I'd been just operating a long hours for many days in a row. But it didn't go away, and it got to the point where over about a week or two, I was noticing it with any movement. I mean, even at rest. I mean, it was constantly present. But what made the transition in bringing it to a greater attention was not only the duration. It had been about 2 weeks, but then I began to notice weakness of my triceps muscles, and I regularly do push-ups in the mornings, and I noticed that I just couldn't push off with that right arm anymore. So the first step, if you have a neurologic problem, if you have a nerve deficit, which is what I had, in that the nerve wasn't working well enough to serve the muscle, is you should have it evaluated.
Sure.
Well, I didn't do it the formal technical way. I didn't make an appointment to go see somebody because, I knew it and I could evaluate myself.
Sure.
And I informally talked to a couple of colleagues, and they had them examine me, and they confirmed that I had a little bit of triceps weakness. Now there's a grade. Now if I couldn't straighten out that arm at all against gravity, for example, that would have been much more serious. But the weakness was relatively mild. It was there, noticeable, but relatively mild.
Okay. So what you're describing is the pain is in the neck going down into the arm, and you suspected it might have been a nerve issue. You called a good friend or colleague, which is good. And so that's why we're doing this show, because not everyone has someone they can call, right? And so they may have to wait. I don't know, typical surgeons right now, if I send a referral, it's at least a month to get in, maybe longer.
It depends.
Yeah.
But if there's a significant issue, I mean, even if you're not going to see a surgeon right away, you might as well see your primary care physician. And if they notice a weakness, they'll call the surgeon up and say, oh, this person has weakness.
Well, we
need to have you seen them sooner rather than later, and then accommodations can be made. I mean, worst case scenario, if you really have a significant problem, you might need to present to the emergency department and to be seen right away.
Sure. And that makes a lot of sense. And so in your case, it didn't seem like it was an emergency. You weren't planning to hop on a surgeon's table the next day, but you suspected you had something going in the neck, probably pressing on a nerve or irritating a nerve.
Yes.
And so just kind of like we talked about before, the dermatome map, you can usually see which nerve is most likely to be the one that's causing all these problems.
And in this instance, the location of the pain, C7, the C7 nerve, the seventh nerve in the neck, the cervical spine, can localize into the upper shoulder blade region.
Sure.
But most specifically, the fact that the triceps muscle was weak,
right,
localized to that particular nerve. So I had a sense that nerve was involved. So I talked to a couple of different surgeons, and it was interesting. I mean, I think you understand why people have second opinions and they see different people because people might have different perspectives. I mean, both well-meaning surgeons. One person said, "Well, if I were you, I would consider getting an MRI scan and probably move towards having surgery if it showed that there's something pressing on the nerve." I mean, he meant that honestly. I mean, he had no skin in the game. The other one said, "Well, I don't. You could go either way. I wouldn't necessarily recommend surgery."
Sure.
I mean, and he said, "Whatever you think."
So I like to explore that line of thinking a little bit because here you are, you're a neurosurgeon. Your livelihood depends on you being able to use your arm.
Sure.
But then there's also the double-edged sword. If you have surgery, you're not going back to work for a while, right? So a normal person coming in, having to make these decisions, you have, the education and the history and the experience to know I can tough this out or I really need to get surgery, but someone else may not realize, should I go to work? Should I get surgery? What helps them make that decision? A lot of times people come in and they'll say, oh, my MRI showed this, but it doesn't sound like you had one. Did you get an MRI?
No, I didn't get an MRI. I
Okay.
think in a situation like that, the reason to get imaging study is if you need to confirm there's a certain process going on because you're going to make an intervention.
Sure.
Now, I decided not to pursue that route because I realized that most of the time, 80, 90% of the time, surgery isn't required for a situation like this where you don't have severe nerve dysfunction. So realizing that, I decided I would do the conservative route and
Okay.
maximize my chances for improvement and recovery without doing the imaging and then considering surgery.
Okay. Well, I couldn't very well call myself a pain doctor if I don't ask this question. On a scale of 0 to 10,
Yeah.
what was your pain level most of the time?
I would say it was about a 4.
4. Okay.
Yeah.
So on the lower end of the scale, I
Yeah.
can say it's tolerable, not terrible.
Yeah.
Right. Yeah. So it's annoying pain, but
Yes, I was still able to go to work.
sure.
But I was always aware of it.
Right. So
And it affected my ability to get to sleep because I had to get a certain comfortable position to settle down.
sure. And with the pain scores, we ask about those because one, they help us compare your progress if you're getting better.
Right.
And it's only specific to you. Your 4 is your 4.
Right.
It doesn't matter if someone else's 4 or my 4 is their 10. That doesn't matter. But it also helps for documenting the severity of what you have going on for even insurance coverage. If you need to get insurance coverage for surgery or an injection, they want to know what was your pain score. And if it's not high enough, they say it's not medically necessary. So to get the treatment that you may need, those scores are important. But in your case, it's about a 4. But as if you're playing, cards, you had a kicker. You also had this weakness in your arm.
Yeah.
And so that's another thing that goes into your decision-making process
Right.
of what you're going to do.
Everything has pros and cons.
Sure.
I mean, there was a risk that I could have progressed on to have more weakness and that could have affected my ability to function. On the other hand, if I had gone the route of surgery, it's small, but there's a risk of surgery. There's
Sure.
a risk of having complications from the surgery.
Sure.
And so every situation, there's usually pros and cons. There's generally not one clear answer, and every situation has to be individualized.
Absolutely. So help me complete this list for patients. So reasons to request imaging or ask for imaging: severe weakness or progressive is getting weaker as the days go by. Sometimes unrelenting pain. And then you mentioned if you're planning to have some type of intervention, injection, surgery, something like that. Is there anything else you would add to that list? You're listening to The Nervous Breakdown, where we explain the brain, spine, and pain. But please remember, this podcast is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your own healthcare provider with any medical concerns. Listening to this presentation does not constitute a doctor-patient relationship.
We've done an episode where we talk about red flags.
Sure.
And those would include significant weakness, severe pain. You mentioned if there was a history of cancer,
Sure.
there could be a possibility that this could be a manifestation. If there's any fever that could suggest there's an infection process going on. There's some people are what's called immunocompromised. Their immune system isn't robust.
Right.
So in those situations, you should have a lower threshold because if you're immunocompromised, you might be more susceptible to having infections
Sure.
and things like that.
And there's some medications that cause that. Like a lot of the anti-inflammatories or a lot of the medications used for autoimmune diseases, they can lower your risk, lower your immune response, like Humira and things of that nature. So patients that are on those types of medications,
Yeah.
important. That's why it's important to have a good list of your medications when you go in to appointments, and it's not just, checking a box. It helps us make the best decision or give you the best advice when you do come in.
Yeah. So the other thing I should mention, especially related to the cervical spine, and I mentioned the nerve issues with weakness, for example. If there's a process pressing on the spinal cord, that could cause significant problems such as balance difficulty. One could have trouble walking.
Sure.
I mean, further down the road, it could affect the ability to control bladder and bowel.
Sure.
So those are serious red flags that require immediate evaluation. I mean, if I had any of those things, I wouldn't have taken such the route
Sure.
such the route as I took.
Right. And I'm glad you mentioned that because it can be a problem in the neck and cause symptoms down
Oh,
the legs,
absolutely.
right? So
Absolutely.
that issue up there can cause everything you just named. And so being astute, seeing someone that can examine you and kind of help you make
Right.
an informed decision is very important. So
Yeah, and I think you make an excellent point of doing an examination because you may not feel any unsteadiness, but if you are evaluated by a qualified physician and they can notice abnormal reflexes that could indicate that your spinal cord is being compressed, and that might be the first sign of something like that. And that would precipitate a needing to look into it further with a scan, for
for
example.
sure. But we often minimize our own symptoms, right? We say, oh, it's just this, it's just that. And so having an objective examination, like you said, certainly finds these things that we might otherwise ignore. So yeah, so what else about your experience? Did you take any medications? Did you do any physical therapy? Or what else did you do to get out of your, avoid the knife?
Yes. So when I decided that I was going to take a conservative route and basically give my body the best chance to heal, the first step was to take a couple of weeks off and devote myself to the healing process. So I made sure I was sleeping well, getting a good night's sleep, getting well rested, eating a good diet, and then working on the physical aspects of it. So one thing that I did was to do cervical traction. There are different devices on the market. One of them has a device that goes under the chin and behind the
Sure.
head that provides. It's connected to a pulley that you hang over the door. You put water into a bag that
Sure.
gives you whatever weight you want. And another one is a device you can lay back on, and it goes into the back of the head, and it does the same process by sort of pushing on the shoulders and pushing back the back of the head. But basically, I did 25 pounds for
Yeah.
my situation. I did 25 pounds for 10 minutes, 3 times a day.
Right.
And theoretically, a couple of things that might do, it might, if you're having neck spasms, neck muscle spasms, that could be the basis of the pain. It could help to get that to settle down.
Relax the
But
nerves.
yeah, but
Awesome.
also if the area where the nerve is exiting the spine is somewhat narrow, what's called stenosis. I think one theoretical idea is that by doing traction, you're
Sure.
opening up that space,
Sure.
giving the nerve more room to potentially let the swelling settle down
Sure.
and maybe even enhance the blood flow to the nerve to allow it to settle down. So I did that. I did traction,
Right.
and I did some stretching exercises. Uh, and then I wanted to work on my strength. So I got a list of exercises that would specifically address the triceps muscles, and just using light weights and progressively increasing. I worked on strengthening the triceps muscles.
Good.
So after about a week or so, I could see that things were settling down, and towards the 2 week period, the pain was much better, and I could see a turnaround with the weakness.
So just to give the big fancy medical term, it sounds like you had cervical radiculopathy, which just means the nerve is not functioning properly. We talked about radiation of pain, going somewhere you can feel it, tracing where the nerve runs. In your case, is in the arm. And then treatments for that, you can either remove some of the pressure off the nerve, and that's where the traction did. You can eventually, you could have surgery that opens up the space and gives you immediate space around the nerve. There's other things. There's injections that calm down the irritation. The nerve gets upset, it swells. So you do anti-inflammatory or steroid injection that kind of calms down the irritation, gives the nerve a little bit more room. So while you do things like physical therapy and such, that hopefully changes the mechanics. So there's not as much pressure on it. And then, of course, there's medications, the nerve pain medications, common ones being gabapentin, pregabalin, and those just act kind of like noise cancellation headphones. Everything that's irritating the nerve is still there. It doesn't do anything for that. It doesn't calm down the inflammation. It just makes it so the nerve doesn't care about it and doesn't react so much. Just like headphones, you don't hear the noise, but it's all still there. If you take them off, just like if you stop taking the medication, it all comes back, right? So in your case, you didn't have to do any of that for the most part, except the traction, and underscores the kind of breadth of things that can be done to address these pains. You don't have to start with the most, extreme, which is surgery, and there's a lot of things you can do even at home. So any other take-home points to someone that might be experiencing the same type of symptoms you have that doesn't have a medical network or they don't watch our podcast?
I think we've covered most of it. The important thing is to get an evaluation to make sure there isn't anything worrisome.
Sure.
The next thing is to make sure that your body is in the optimal position to allow it to heal itself. But you need to get an appropriate evaluation to make sure there aren't any red flags, anything concerning that would require a more immediate process that could require a quicker consideration of surgery. But as I said, most of the time surgery is not needed. Most of these things resolve with non-surgical treatment. In my case, I suspect I probably had a part of the disc protrude out and irritate the nerve. If that process had not relented and I would have needed to have surgery, it might have just been a minimally invasive procedure just to remove the part of the disc that was compressing the nerve. So, of course, we don't know because I didn't do any imaging. But as I said, imaging isn't always needed unless I think anytime you do imaging, it ought to be within the context of you're going to do something with.
What are we going to do about it? What are we going to do about it?
Yeah.
Absolutely.
Yeah.
So there you have it. You heard it first here. The surgeon who heals without a scalpel. You can heal yourself and be a miracle worker just like him if you follow these principles. So we thank you for joining in The Nervous Breakdown, and we'll see you next time. I'm Dr. Christopher Gay.
I'm Dr. Estrada Bernard. If it's the spine, the brain, or pain, we explain in language that is plain.